Welcome to Thursday Dairy Update. This is Kathy Barrett with the Cornell ProDairy program. ProDairy and Dairy Business Communications is pleased to be able to offer this webinar series. Today we're going to be talking about reproductive management first service after calving. Next week we'll be talking about reproductive management focusing on second and subsequent service. For both of these webinars, we're pleased to have Dr. Julio Giordano as our presenter. Julio is an assistant professor of dairy cattle biology and management at Cornell University. He's a DVM and PhD and does his research and teaching in this field. So we're pleased to be able to have Julio share his research and his insights on this important topic.
So like Kathy mentioned, I wanted to divide the area of repro into main different components. And one of those was first service postpartum because of the multiple different management strategies that we have available, and we will do in the next one second and subsequent breeding. But before we start talking and discussing some of the latest reproductive management programs for dairy farms, I would like to leave you with a few take-home messages about what is going on in the world of reproduction in the dairy industry. So one of the things that is very interesting is the tremendous progress that the dairy industry has made in recent years in terms of reproductive performance. One example of that is the information that I'll have here in this slide, which basically is a summary of the 21-day pregnancy rates, which you can see here in the y-axis, for the award winners. So these are herds from all over the country that have been awarded for their excellent reproductive performance at the annual meeting of the Dairy Cattle Reproduction Council, which, by the way, was held this year in Buffalo about a month ago. So what you can see here is, again, is the 21-day pregnancy rate in the y-axis, and here you have the data represented from 2009 all the way from 2014. And what is very interesting about this data is that the pregnancy rate for these herds has fluctuated between 30 and 40%. And these are numbers that maybe 5 to 10 or even a few more years ago were probably unheard of for commercial dairy farms in the U.S. So basically, the dairy industry has worked very hard over the years to achieve this level of excellent reproductive performance. And at the same time, it is important to also keep in mind that milk production continues to go up, health of cows continues to get better. So the message basically is that it is possible to obtain outstanding reproductive performance with the type of production systems that we have today. So basically, there is hope, there is a light at the end of the tunnel, so herds that are well managed can certainly achieve excellent reproductive performance. Probably not all herds will reach a 30 or 40% pregnancy rate, but those herds that work hard and try to implement an effective reproductive management program can probably get to those levels. So another aspect of reproductive management programs for dairy farms have to do with how do we achieve high 21-day pregnancy rate or high reproductive performance, whatever way dairy producers or consultants want to measure it. And my personal opinion, based on my observations working with a lot of different commercial herds through our research and our extension programs, is that for the most part, most herds want to get to high 21-day pregnancy rate or high reproductive performance. And most of the herd will be at a starting point when they have to make the decision of what reproductive program is the best for their system or for their own operation. My take on this is that there is not only one way of getting to high 21-day pregnancy rate or good reproductive results. In fact, what we have is many different ways. There are many different pathways or reproductive management strategies that dairy farms can use to achieve success. Whereas some farms will rely more heavily on the use of estrus detection to inseminate the majority of their cows, other herds will probably prefer or will need to rely more heavily on the use of time AI programs. What is important and what we'll be discussing today too is that for the majority of the herds that prefer or want to rely more heavily on the use of estrus detection, it's very likely that they will still have to combine those programs, those estrus detection programs, with time artificial insemination. So basically, again, many farms will have many different ways of managing reproduction. What is important for dairy producers and consultants is to be aware of what are the reproductive programs that are available and what are the best for their own operations. In a recent study that we conducted, this is a survey study which has not been published yet, we asked dairy farms from anywhere from 300 to 5,000 cows, and the results that I'm showing you are partial results. We'll finish completing this data set within the next few months. But we asked dairy farms, so what was the reproductive management strategy that they used to manage cows for first service? And we gave them three options. It was either 100% estrus detection, 100% time artificial insemination, or a combination of detection of estrus and time AI. And as you can see, there is a predominant number of dairies that are using a combination of detection of estrus and time AI, with almost 2/3 of the farm using such a strategy. But we have about 1/4 of the farms using 100% time AI for insemination for cows on their first service postpartum, and a very few farms or a small percentage of the farms that are still using 100% heat detection to inseminate their cows for first breeding. What is very important, and again, I mentioned this before, is that the farm knows and the consultants working with farms know what are the programs available, and very importantly, what are some of the resources, or what are the resources that the farms do have available to implement a reproductive management program. One of the most critical factors to take into account at the time of making a decision on the type of reproductive program is, of course, people. Do we have people available and people that are sufficiently trained to be able to conduct a complex reproductive management program? Do we have technologies such as dairy software that are capable of generating a list of cows to give injections or for heat detection that people can use to implement the program? Do we have technologies such as RFID or activity monitors for estrus detection to help with estrus detection? So each farm will have a different set of resources. Again, what is important is that at the time of making the decision on the selection of the reproductive program, we assess what are the resources available to each farm and make our decision based on those resources available. So, with that said, I'll start describing first the programs that rely more heavily on estrus detection, and we will touch later on those programs that use time AI more heavily for first breeding postpartum. So one of the things that we have to think about when we have farms that want to use heat detection to inseminate the majority or most of the cows is whether or not we can rely 100% on the use of heat detection, or whether it is necessary to combine that estrus detection program with a time artificial insemination program to deal with some of the cows that could be problematic. As you know very well, it is not that easy to spot this type of situation on the dairy farm. So finding cows that are showing, the ultimate sign of estrus, which is standing to be mounted. And there are some challenges that our lactating dairy cows are facing, such as the type of flooring in which they are housed, the type of barn in which they are housed, the stocking density, and there are also some physiological limitations on the cow side, as for example, milk production, which as milk production continues to increase, lactating dairy cows will tend to show less heats and heats of less intensity. So we have a set of challenges that are important to keep in mind when thinking of using 100% heat detection to inseminate our cows. So basically the question is, can we use that type of strategy in our high-producing dairy herds? As you know very well, there are many different ways to detect cows in estrus. We have, the very traditional approach of visual observation, which basically consists of people observing cows either once or more than once a day for a period of 30 to 45 minutes per day, if done correctly. And then we have a set of aids such as tail paint, tail chalk, or paint or spray paint that can be used to aid either with visual observation or as the sole method for detection of estrus. And as you know very well, none of these techniques are infallible, so they all have limitations. In particular, visual observation, it's an activity that can become very monotonous, very boring, and many times farms don't have in place the right program for heat detection. A few years ago, activity monitoring systems, so automated activity monitoring systems for detection of estrus became available, and they came up to the industry and they looked like a really interesting tool, a really good tool that dairy farms could use to replace visual observation or some of the other aids used for detection of estrus. But what is very important and very interesting about this type of technology is the fact that either these tags placed in collars or in leg bands, they will monitor cows 24/7, and in that way, this technology can help limit some of the problems that we had with the more traditional techniques for heat detection. So these systems were also very useful to study the biology of cows and the ability of cows to show estrus and ovulate as we expected, to see if we could develop programs that rely 100% in estrus detection to inseminate cows. So I'll show you now some research that has been done at the University of Wisconsin looking at the ability of these automated activity monitoring systems to detect cows in heat, and the potential to use these tools as an alternative to more traditional ways of estrus detection in dairy farms. So in one study done with lactating dairy cows in early lactation, the objective was to test how well an automated activity monitoring system could detect cows in estrus and whether or not cows ovulated after they were detected in estrus by the system. So for this study, cows were synchronized with a very simple protocol consisting of an initial GnRH injection followed 7 days later by a prostaglandin injection to induce luteal regression and induce estrus. And this was done, of course, to make the life of researchers a little bit easier, because after the prostaglandin injection, cows were detected in estrus based on the activity monitoring system. A KMAR device was also placed in the cows, and very importantly, ultrasound was conducted every 8 hours to check ovulation, and blood samples were collected to evaluate the response of the cow to the protocol and whether or not they could consider to do heat. So basically the objective was to evaluate whether or not cows were detected in estrus after the prostaglandin injection, and out of those cows that were detected in estrus or not, whether they ovulated or not after the prostaglandin injection. So the results were quite interesting, and what you can see in this pie graph basically is a breakdown of the 4 different type of cows that were observed in the study. The type of cow that will probably allow the system to be the most successful are those cows that show heat and ovulated. The percentage of cows that were represented in this group were 68%, so basically we have about 2/3 of the cows that are doing what we expect. These cows are showing heat that, in that case they can be detected by the system, and after they show heat they go on to ovulate, so it's very likely that if the insemination technique was correct, these cows could get pregnant. However, there were 2/3 of the cows, or about 30% of the cows, that had either 2 problems or one of the 2 problems that we don't want to have a successful program that relies on detection of estrus. There were almost 20% of the cows that failed to show heat and also failed to ovulate. In this case, it's very unlikely that the system will be successful because the cows are not showing the signs necessary to be detected by the technology, and even worse, these cows are not ovulating, so there's no chance of pregnancy. On the other hand, there were 10% of the cows that failed to show heat, but they went on to ovulate. In this case, the system could not find the cows because they were not showing any sign of heat, but they have silent ovulations. In this case, these cows will not be inseminated, and they would also represent a problem. And finally, we have about 3% of the cows that, even though they were detected in heat, they show heat and were detected by the system, they failed to ovulate. So basically what happens is that we have some biological limitations at the cow level that are limiting the potential success of either an automated activity monitoring system or of a traditional heat detection program. So every dairy farm will have a certain proportion of their cows that will have one of the problems that we observed in this study, and therefore they will not be inseminated on time, or they will fail to become pregnant after they are inseminated. So as a consequence, before that, I just wanted to point out that the results that were observed in that study were reported once, more in many other studies that have looked at the same thing. So it seems that, it is pretty common. It is a situation that is affecting dairy cows all over the country. The majority of these studies were done in different parts of the country, and therefore it seems to be something that, dairy producers and consultants should pay attention to when trying to use a program that relies heavily on heat detection. So when thinking about the potential practical implications of this type of situation, here we have a really good example. This is data from Dairy.com. This is the graph that shows the days in milk to first breeding postpartum for individual cows for a 12-month period. And basically what you can see in this graph is a significant change in the pattern of insemination for first breeding. While cows were being tightly inseminated within a narrow time frame after the end of the voluntary waiting period until about early November of 2012, something happened here by which a lot of cows are starting to be inseminated very late for first breeding. So there's a very clear change in the pattern of inseminations for first breeding, and although we have some cows that are being inseminated earlier than what they were bred before, there is a significant proportion of the cows that are being bred later, and many cows are getting inseminated well beyond the timing that is probably ideal to receive a first insemination. So one of the consequences that we have to expect when no sync protocol is used to deal with this proportion of cows that were either failed to show estrus or failed to ovulate, is that we will have an extension of the days in milk to first insemination. So one of the take-home messages here is that, based on the research data that I presented, as well as some research, data from dairy farms, from commercial dairy farms, it seems obvious that some sort of synchronization of ovulation protocol is needed in combination with the estrus detection program. So some follow-up studies that were conducted in this area were aimed to try to identify potential strategies to still breed as many cows as possible based on a detected estrus, but always using a time AI program to deal with that proportion of cows that was expected to not do very well. So this is the experimental design for a study that was also conducted in Wisconsin, in which different strategies that combine estrus detection, in this case based on automated activity monitoring, with time AI could be used for first insemination. So for treatment 1, what was the main objective of this group was to maximize the insemination of cows based on heat detection or based on activity. So for this treatment in particular, after the end of the voluntary waiting period, at approximately 50 days in milk, cows were inseminated based on activity. However, before the end of the voluntary waiting period, cows were divided into groups. Those cows that showed activity or showed estrus before the end of the voluntary waiting period were assumed to be cycling and therefore be more likely to show estrus after the end of the voluntary waiting period. Therefore, for that group, cows were allowed to be inseminated based on activity up until 79 days in milk, and only after that, if they were not already inseminated, were enrolled in the Ovsynch protocol. On the other hand, for cows that did not show activity before the end of the voluntary waiting period, and therefore were thought to be non-cycling, in this case, cows were inseminated in activity from the end of the voluntary waiting period until 65 days in milk, when they were enrolled in the Ovsynch protocol if not previously inseminated. The idea behind this strategy was to take advantage of the fact that we knew, or we thought that we knew, the cyclicity status of cows before the end of the voluntary waiting period, and allow those cows that were cycling to have more time to express estrus, and therefore maximize the percentage of cows that were inseminated based in estrus. On the other hand, treatment 2, which was also designed to maximize insemination of cows with estrus detection, used the Presynch protocol, or 2 prostaglandin injections 14 days apart, to synchronize estrus and maximize the percentage of cows that were inseminated after the end of the voluntary waiting period. And similarly then for the treatment 1, what we had was the Ovsynch protocol 12 days after the second prostaglandin injection of Presynch to deal with those cows that were not detected in estrus. So this is basically a Presynch-Ovsynch protocol with estrus in combination with estrus detection, or cherry picking, like many people in the industry refer to. And finally, there was a control group, treatment 3, which was the complete opposite of the other 2 treatments. In this case, the idea was to breed 100% of the cows based on time AI. In this case, we used also the Presynch-Ovsynch protocol. The protocol was laid out to be set up at the same days in milk as cows in treatment 2. with the exception that cows were not inseminated after the second prostaglandin injection. So 100% of the cows, regardless of whether or not they showed estrus based on activity after the second prostaglandin injection, went on to complete the protocol and receive time AI. This is also a protocol that is commonly used by some dairy farms, and is the extreme situation in comparison to the other two that try to maximize insemination based on estrus detection. In this case, all the cows receive time AI. Interestingly, when the results were evaluated, and these are just some partial results, and the numbers that were most important will be highlighted here. And this is in line with what was observed in our previous study, looking at the percentage of cows that were detected in estrus and ovulated after being synchronized. About 56% of the cows in the first treatment group, so the one that used only activity plus the Ovsynch protocol, were inseminated based on a detected estrus. So in this case, even when we gave cows the opportunity to be detected in estrus without any intervention, we still had 40% of the cows that ended up going through the Ovsynch protocol and receiving time AI. On the other hand, for the group that was synchronized with the Presynch-Ovsynch protocol, but cows were inseminated based on activity, again, 70% of the cows, in this case 14% more cows were detected in estrus. This is likely due to the effect of presynchronization with the two prostaglandin injections were detected in estrus, but still 30% of the cows needed to go through the Ovsynch protocol. For the third group, for the Presynch-Ovsynch with 100% time AI, I remind you that all the cows received time AI. However, we also collected the data for activity, and 70% of the cows, and this is very interesting, is exactly the same percentage for the group in which cows were inseminated, were detected in estrus based on activity and would have been inseminated if we would have allowed the farm to do so. But what is more important, and at the end what matters to dairy producers, is what happened with the time of pregnancy during lactation. So this graph is a survival curve for time to pregnancy from the beginning of lactation until 300 days in milk. So basically, we start with 100% of the cows non-pregnant, and as cows become pregnant through the lactation, the survival curve will go down until the end of the trial at 300 days in milk. So the quicker the line goes down, the faster the rate at which cows become pregnant. Interestingly, for this study, we did not observe any difference for time to pregnancy or median days to pregnancy through lactation. As you can see here with the data, the time at which 50% of the cows were pregnant with all the treatments was the same. We had, of course, some differences early in lactation after the end of the voluntary waiting period, because the groups in which cows were inseminated after a detected estrus, they start becoming pregnant earlier than in the group that receives time AI, which is the green line in this case. And in this case, what happens, all the cows, or 40% of the cows that become pregnant after first breeding, will do it on the same day. So at the end of the day, the take-home message is that regardless of the differences in the different management strategies that we compare, which I remind you were meant to either maximize the insemination of cows after detected estrus based on automated activity monitoring or time AI, at the end of the day, time to pregnancy was the same. So the message is that dairy farms and consultants can decide what is the best alternative for their own farm. So for farms that do have an automated activity monitoring system, or for farms that do not have one but they prefer to inseminate the majority of their cows based on estrus detection, they could use estrus detection as the primary strategy to breed cows, as long as there is a time AI program to deal with those cows that will not be detected in estrus. So here you have basically the take-home message, and what is very important, of course, in such a case when farms decide to breed the majority of cows in estrus, maximizing the proportion of cows inseminated in estrus, and of course having high conception rate to those estrus detection breedings. So, putting it all together and summarizing the research data as well as some of my experiences working with commercial dairy farms, I put together this figure in which I summarize some of the potential alternatives that I see for management of first service in dairy farms that want to, again, maximize insemination of cows based in estrus. And these strategies will vary in intensity from very conservative and low intervention to a little bit more intervention, always within the realm of maximizing insemination of cows in estrus. So a potential alternative that dairy farms have is to start inseminating cows after the end of the voluntary waiting period in estrus, but after a certain number of days after the voluntary waiting period, those cows that were not detected in estrus should be enrolled in the Ovsynch protocol to ensure proper timing of insemination. What will vary across farms is the amount of time that they can allow cows to express estrus. And this is just a criteria that I picked, and it's not necessarily the only, or these are not necessarily the only options or the only range. But what I always recommend dairy farms is to give cows less or more time to express estrus before being enrolled in the Ovsynch protocol, based on the success that they have to find cows in estrus. Farms that have low heat detection after the end of the voluntary waiting period should consider having a shorter period until the beginning of the Ovsynch protocol, so potentially one whole estrus cycle is enough. Whereas those farms that tend to have or historically had higher heat detection rates, they can wait a little bit more. They could wait probably up to 35 days after the end of the voluntary waiting period until they enroll cows in the Ovsynch protocol. So this would be the least intensive strategy. It relies heavily on heat detection. There is no use of prostaglandin before the end of the voluntary waiting period, and the length of the period from the voluntary waiting period to Ovsynch depends upon the previous history or the known ability to detect cows in heat. On the other hand, a strategy that is more interventionist would include the use of prostaglandin injections to induce estrus. This strategy would consist on the administration of a first prostaglandin injection at the end of the voluntary waiting period, followed by 14 days of estrus detection. 14 days after that injection, those cows not detected in estrus would receive a second prostaglandin injection, another 14 days of estrus detection, and only after those two opportunities after prostaglandin injections, cows will be enrolled in the Ovsynch protocol. And finally, the strategy that is the most intensive in this case, but still takes advantage of the use of heat detection, is the use, again, of two prostaglandin injections 14 days apart. However, in this case, the first prostaglandin injection is given 14 days before the end of the voluntary waiting period, and only after the second prostaglandin injection, cows detected in estrus will be inseminated, and those that will not be detected in estrus will go to the Ovsynch protocol. As many of you would have noticed, this is basically the Presynch-Ovsynch protocol. In this case, starting at the end of the voluntary waiting period with the first prostaglandin injection. In this case, starting before the end of the voluntary waiting period. So again, these are three potential management strategies, and this is again for farms that have an interest on maximizing insemination of cows based on a detected estrus. Before I continue, I would like to very briefly show you some data that pertains to the use of the Presynch-Ovsynch protocol. As I just mentioned, two of the strategies that I would recommend include the use of the Presynch-Ovsynch protocol, and in particular for the second strategy is very common, where the second prostaglandin injection is given at the time of the end of the voluntary waiting period. The Presynch-Ovsynch protocol is widely used, and the original protocol had a 12-day interval from the second prostaglandin injection to the beginning of ovsync. Dairy farms like this type of protocol a lot because they can inseminate a high percentage of cows in estrus after the second prostaglandin, and only the cows that have not been detected in estrus will receive the time AI. However, many years ago, there has been some research done showing that dairy farms should not use a 14-day interval from the second prostaglandin to the ovsync protocol. And this is important from a practical perspective because many dairy farms like to use what we call the Presynch-Ovsynch 14-14 protocol because it's more practical. Because most of the injections, if not all the injections, can be given on one day, except for the last generation injection, all the injections can be given on one day of the week. And the recommendations for many years based on a study conducted in California was to not use the 14-day interval from Presynch to ovsync because there would be a reduction of about 7 percentage points in pregnancies per AI when using the 14-day interval. So one of the caveats of the study that was conducted to come up with this conclusion is that that study only included cows that were inseminated based on time AI, so there was no heat detection at any time point during the protocol. However, like I previously mentioned, a lot of dairy farms like to use the Presynch-Ovsynch protocol because they can detect a lot of cows after the second prostaglandin injection. So one of the questions was, what are the consequences of still using a 14-day interval for dairy farms that include estrus detection during the Presynch-Ovsynch protocol? So we recently conducted a study in New York State with multiple dairy farms. About 3,000 cows were enrolled in this study. And the question was very simple. Can we use a 14-day interval from Presynch to ovsync when estrus detection is used anytime after the second prostaglandin injection of ovsync? So basically trying to challenge the idea that when using the 14-day interval, those cows that were inseminated after the time AI would have reduced fertility as shown by the previous study. The results are quite interesting. What you have here are pregnancies per AI for cows that were inseminated in estrus. So these are the cows that were detected in estrus any time after the second prostaglandin injection. And of course, for this group of cows, we did not expect to find any differences because cows received the exact same treatment, the exact same interval between the prostaglandin injections, and as expected, there were no differences between these groups. But when we looked at the cows that received the time artificial insemination, in support of our hypothesis, we observed no differences in pregnancies per AI whether cows went through the 14-14-day protocol or the 14-12 protocol. So basically what this data supports is the idea that when farms use estrus detection during the Presynch-Ovsynch protocol, the 14-14 interval still works, and again, many dairy farms will use it because it's very practical, so farms can take advantage of the practicality of the protocol without fearing any potential reductions in fertility for those cows that receive the time AI. So the take-home message is basically that when using Presynch-Ovsynch, but in combination with detection of estrus, there is no need to reduce the interval from Presynch to Ovsynch to less than 14 days. So this concludes our part for the type of strategy that tends to or prefers to maximize insemination of cows in estrus. And we will start now discussing the opposite situation. So the type of management strategies that can be used by farms that prefer or need to use time AI for first breeding postpartum. So one of the questions that I get very often from dairy producers that is very important whenever we are trying to use 100% time AI program is, can we maximize, can we have very high fertility to those time AI breedings when we don't do any heat detection? So a really good target for dairy farms that are trying to breed cows in time AI will probably be to get conception rates in the 45 to 50% range. So the question is that achievable? Has research shown that it's possible, and are some commercial dairy farms achieving that level of success? So one of the things to think about when farms are considering the use 100% time AI for first breeding is that using the Ovsynch protocol alone, so the Ovsynch protocol without any sort of presynchronization strategy, is probably not the best idea to maximize fertility. I will not go in detail through all the limitations that cows have when they go through the Ovsynch protocol, because there are too many and they are not as interesting from a practical perspective. What is important is to recognize that the Ovsynch protocol is not perfect, and because of that, cows will have fertility that is either very similar or in some cases slightly lower than that observed for cows that are inseminated based on estrus detection, and for sure lower than that fertility that we can expect from other time AI programs that are more complex but were designed to maximize the fertility of lactating dairy cows. So basically, as a take-home message, we have that using the Ovsynch alone is not an ideal program to maximize the fertility of cows for first breeding. And once that a herd has committed to use time AI, they probably have to think of using other alternatives. So, what are some of those alternatives? Basically, the programs that have been designed to maximize the fertility of first breeding all include some sort of pre-synchronization of the estrous cycle. Here you have three examples of these programs, which we have been already discussing some of them, and others you may already be familiar with. We have the Presynch-Ovsynch protocol, we have the double Ovsynch protocol, the G6G protocol, and of course they are different in the type of interval, in the intervals that they have between the injections, and also in the type of injections that they use. However, all of them have been designed with the same purpose, and that is to set up the estrous cycle of the cow to be at an ideal stage to start the Ovsynch protocols when cows begin the second part or the breeding Ovsynch part of the protocol. So basically they use different injections, they use different intervals, but they all do the exact same thing from a physiological perspective, and that is to have the majority of the cows set up at approximately day 7 of the estrous cycle when they receive the first generation injection of the Ovsynch protocol. Because we don't have time to discuss all the protocols, I will focus more on the double Ovsynch protocol, which is one that has been and is being used quite successfully by many commercial dairy farms, and one for which there is quite a bit of research showing its benefit in comparison to some of the other programs. So, like the name of the protocol implies, the double Ovsynch protocol is relatively simple. It's 2 Ovsynch protocols separated by 7 days. So the first part of the protocol is what we usually call the pre-Ovsynch or the pre-synchronizing part of the protocol, and that is followed 7 days later by the second part, or the breeding Ovsynch. For farms, here you have a calendar view of the protocol, and the reason why I show you this is that when the protocol is evaluated on a timeline like here, it looks quite complicated. It requires a total of 6 injections. However, from a practical perspective and practical application on dairy farms, it can be simplified by enrolling cows on a weekly basis and having only 3 days of the week at which cows should receive injections, and then the 4th day of the week in which all cows are inseminated. So again, the protocol is relatively complex, but it can be applied on commercial dairy farms in a relatively straightforward manner, most of the time with the help of dairy software that creates the list of cows. So one of the questions is, so what should dairy farms expect from the use of a program such as double Ovsynch? And I'll show you now an example of a dairy farm. This is a commercial dairy farm in Western New York that has been using the protocol for a while. And one of the things that should be expected is to have a very tightly controlled timing of insemination for first service. So basically, cows that are enrolled on a weekly basis will all be inseminated on the same day, so farms are able to have all their cows bred by an X number of days in milk that they set as their goal to inseminate cows for the first time. And what is very important is the conception rate that herds should expect to obtain with this type of program. I think that this is very powerful, and what farms are seeing with this type of synchronization protocol is very interesting. So for this farm in particular, for a total of 1 year worth of data and about 1,000 inseminations, the pregnancies per AI or conception rate for first breeding was an overall of 49%. But what is very interesting too about protocols such as double Ovsynch is that farms should expect some differences based on parity. For example, for this dairy farm, conception rate for first lactation cow was 55%, whereas conception rate for lactation greater than 1 was 45%. So there is not a, from a research perspective, there is not a clear explanation of why this is the case. There's a lot of research evaluating these differences between multiparous and primiparous cows, but this is very commonly observed both in research studies as well as in commercial farms. The interesting thing is how well first lactation animals do when they are synchronized and receive time AI with the double Ovsynch protocol with a very high percentage of first lactation animals that become pregnant. So in summary, the implications and expectation for dairy farms is to expect that 100% of the cows will be inseminated by the end of the voluntary waiting period, and they should expect no less than so about 45% conception rate with no less than 40% overall. Some herds can push very, very high conception rates overall with up to 60%. And of course, keep in mind some of the differences for lactation groups. One of the common questions that are usually asked by dairy producers or consultants is double Ovsynch better than Presynch-Ovsynch? And I'll show you very briefly here the results of one study that has compared the use of double Ovsynch for first insemination, and in this case was 100% time AI. And pregnancies per AI or conception rate was evaluated at 39 days after insemination. So what you can see from this data set, in which we divided the data for primiparous and multiparous cows, is that there were differences between the two treatments. So cows that received the double Ovsynch protocol had 53% pregnancies per AI versus 47.5 pregnancies per AI. That was statistically significant, and it's something that we commonly observe in dairy farms. Again, very high fertility for primiparous cows, and at least for this study, we observed greater pregnancies per AI or conception rate for primiparous cows that received double Ovsynch than Presynch-Ovsynch. For multiparous cows, it's a little bit of a different story. In this case, there was only a tendency for pregnancies per AI to differ, and the pregnancies per AI difference was about a 3 to 4 percentage points in favor of double Ovsynch. So double Ovsynch certainly works also for multiparous cows, but farms should not expect to observe the same differences for multiparous than for primiparous cows when using the double Ovsynch protocol versus the Presynch-Ovsynch protocol. So, in the interest of time, I'll just show you a few more pieces of data with some current or questions that are being asked right now in the industry. And one of those is what about the use of an additional prostaglandin injection in the double Ovsynch protocol, as well as in other protocols such as Presynch-Ovsynch or G6G? So basically the idea is to improve CL regression or luteal regression, which is a limitation of this type of protocol. So instead of just giving one single prostaglandin injection before the time AI, 2 prostaglandin injections are given 12 or 24 hours apart. Some research has been done a few years ago evaluating this type of strategy, and you have the results here. So I'll just highlight the impact of the extra dose of prostaglandin on CL regression and on the fertility of pregnancies per AI. As expected, giving the second prostaglandin injection improved the luteal regression in cows. So, there was almost a 10 percentage point increment in the percentage of cows that had luteal regression. That difference was significant. So basically, the idea is, or the data is supporting the idea that a second prostaglandin injection does improve luteal regression. However, when looking at the fertility of cows or conception rate, the differences are not as dramatic as for luteal regression, and only a difference of about 3 percentage points was observed. It is very difficult to observe, to detect that statistically, so the difference was not statistically significant. And, as I'll show you from now on, it has been pretty consistent. So the data that we are seeing from other research studies, as well as some commercial farms, is an increment in pregnancies per AI of about 3%. So some of the most recent research that has been done, this is some data from Dr. Wilbank in Wisconsin, has looked at this again. So giving one single prostaglandin injection versus 2 prostaglandin injections, and in this case looking at some of the potential differences for primiparous and multiparous cows. Very interestingly, there was no benefit of giving the second prostaglandin injection to primiparous cows, and there was almost a 4%, there was a 4 percentage point benefit for the multiparous cows. So this is also something that is observed in some of the research studies that are being conducted in commercial dairy farms, it seems as the cows that will benefit the most are multiparous rather than primiparous cows. So another alternative is to give, and this is a common question too, instead of giving 2 prostaglandin injections, can we increase the dose of prostaglandin? So this is data from a study that I conducted as part of my PhD. So we increased the dose of prostaglandin, in this case was chlorprostinol, by 50%, and we observed very similar results. So we observed better luteal regression, in particular in multiparous cows, and in terms of pregnancies per EDAI, we observed a 3 percentage point increment in pregnancies per EDAI for both groups. It is important to recognize that in neither case the difference was statistically significant. But again, like I mentioned previously, it has been a very consistent response, about 3 to 5 percentage points across different experiments. So the take-home message for that is that an additional prostaglandin injection before the time EDAI, or based on the data that I just showed you, a 50% greater dose of prostaglandin may improve pregnancies per EDAI anywhere from 3 to 5 percentage points. So each farm has to decide whether or not that's worth their extra time, their extra labor and cost to implement that strategy. And also what is very important is that such strategy may be more effective for multiparous than for primiparous cows. In fact, for dairy farms that usually ask me whether or not they should go on with this type of strategy, I usually recommend to start with multiparous cows first, and probably consider primiparous cows only after they have seen an improvement with multiparous cows. So again, in the interest of time, I'll stop here, and I'll be open to any questions you may have.
So Julio, this is Kathy. We do have a question that from earlier on in your presentation, and it's, why was there a decline in 21-day conception rate in 2014 in the DCRC winter herds?
So the question is why there was a decline in 2014?
Yes, in the 21 days.
To be honest with you, I don't know, but it depends a lot on the herds that are nominated to receive the awards. I'm not completely sure, but I don't think that a herd that wins the award one year can be nominated the next year. But there is certainly a lot of variation for the type of herds that are nominated. I didn't show the data for 2015, but I'm pretty sure that it went back up again, or it was very similar to the average.
Thank you, Julio, for an excellent presentation. If you have any questions for Julio, please feel free to contact him via the email that you can see on your screen. Or if you're just looking for additional information, you can go ahead and check out his website and blog, which is also on your screen. So again, this is Kathy Barrett on behalf of the ProDairy program and Dairy Business Communications. I'd like to thank you for joining us for this webinar.